Good morning from Malaysia for everyone. My name is Dr. Muhammad Aizad, and I will present my study entitled Factors Associated with Health Status Among Coastal Communities in the Tun Mustafa Park, Sabah. Okay, for the introductions, the coastal area in Sabah are probably unique compared to coastal area of Peninsular Malaysia and Sarawak, such as many of their coastal zones are remote and inaccessible. Their public healthcare is also limited in infrastructures and numbers, and they also have high number of undocumented and stateless individuals. Besides, Sabah has the highest poverty rates compared to other states in Malaysia. A previous study conducted in the coastal population of Sabah has reported that several non-communicable disease cases were higher than the prevalence of national and Sabah state. The reported prevalence of this NCD were also inconsistent as compared to national rural population. Moreover, the previous study also reported that the prevalence of undiagnosed cases of NCD were significant among rural coastal communities in Malaysia. This evidence led to the present study objective, which is to determine the health status and its associated factors among the coastal communities in Sabah, Malaysia. So we conducted a population-based study in the coastal communities at Tun Mustafa Park, Sabah, which is one of the marine protected areas in Malaysia. During the data collection, we approached first our respondents and then get their consent to participate in the study. We interview them based on our validated questionnaire, which consists of socio-demographic background, socio-economic, modifiable lifestyle factors, dietary intake, and medical profile of the study participant. Besides, we measure the height and weight for the body mass index, waist and hip circumference, and also the blood pressure. As you can see in this picture, which was taken during one of the data collection trips. We define the health status as good if the respondent denied any self-reported chronic disease and not classified as hypertension from our blood pressure measurement. After the data collection, we perform the statistical analysis accordingly. For result, our study involved 610 respondents and 347 households. Majority of our respondents were Bajau, Muslim, married, female, and received secondary education. In terms of job, majority of them were working as fishermen or involved in the aquaculture activities, and majority of them had low household income. We found that 49% of this coastal population were in poor health status. We also found that 34% of population were at the risk of hypertension, and another 37% had hypertension. Besides, we observed the prevalence of obesity are at alarming rates at 47%. From the regression analysis, we found that factors of older age group and low level of education were significantly associated with poor health status among the respondents, which indicate that the respondent which or the age group and low level of education are more likely to have poor health status. In conclusion, we conclude that almost half of the respondents had poor health status, which reflected a high prevalence of NCD in this population. We suggest that an alternative healthcare intervention tailored to the local context is needed in order to improve the health status of the communities. By that, I end my presentation. Thank you so much.